Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Methadone. Its brand name is Methadose or Dolophine. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Methadone is a synthetic opioid analgesic and is an agonist at the mu receptor. It has many actions similar to that of morphine, particularly involving the central nervous system and organs comprised of smooth muscle. And it may also act as an antagonist at the NMDA receptor. In terms of indications for use, methadone is indicated to be used for drug detoxification in opioid abuse. It can also be used for maintenance therapy, again in opioid abuse. And it can also be used to treat moderate to severe pain in patients who require long-term, around-the-clock opioid therapy. Now, before somebody was to use methadone, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to methadone or any other component of the product, they would not be able to use this medication. It would also be contraindicated in patients who have hypercarbia, which would be too much CO2 in the bloodstream. This medication would be contraindicated in patients with severe acute bronchial asthma who are in an unmonitored setting without the necessary resuscitative equipment available. If a patient had known or suspected paralytic ileus, they would also not be able to use this medication. Paralytic ileus would be an obstruction of the intestine involving the paralysis of the intestinal muscle. It would be contraindicated in patients who have a known or suspected gastrointestinal obstruction. And lastly, it would be contraindicated in patients who have significant respiratory depression, again, if they're in an unmonitored setting without the necessary resuscitative equipment available. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid using this medication in the elderly population who have a history of falls or fractures due to the ataxia, syncope, or fainting, as well as impaired psychomotor function which may occur, which could lead to more falls. Crushing, chewing, or dissolving the tablets may lead to uncontrolled delivery of the medication, which could increase the risk of drug overdose, including death. Patients who have cardiovascular disease who use methadone may have increased sensitivity to central nervous system depressant side effects. Patients should be made aware that hypotension or low blood pressure, as well as orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, as well as syncope or fainting, has been reported. Patients should be made aware that using opioids long-term may cause adrenal insufficiency, which would be a condition in which case the adrenal gland does not produce sufficient steroid hormones. Patients with pre-existing hypothyroidism who use methadone may be at an increased risk of experiencing respiratory depression, so they should use a lower initial dose. And severe obesity would also increase the risk of respiratory depression. Potentially life-threatening serotonin syndrome has been reported. Patients would be at an increased risk of experiencing serotonin syndrome if they were also using other medications that affect serotonin levels. You should avoid the use of this medication in patients with impaired consciousness. Patients with pre-existing chronic pulmonary diseases such as COPD or asthma may be at an increased risk of experiencing apnea or the cessation of breathing. Patients with pre-existing sleep apnea would be at an increased risk of experiencing respiratory depression. And finally, it should be noted that severe withdrawal symptoms may occur with abrupt discontinuation. Now, once somebody has cleared the contraindications and is made aware of the precautions and warnings, and they start to use methadone, the dose they receive will be dependent on what they're using it to treat. If somebody's using methadone to treat moderate to severe pain, they would typically individualize the dose based on things like prior analgesic treatment, degree of opioid tolerance and experience, severity of pain, general medical status, as well as what other medications they're using. If they're using methadone as their first opioid, they may start off with an initial dose of 2.5 to 10 milligrams given every 8 to 12 hours. They would then titrate the medication based on response and tolerability, and it should be noted that some patients may need an increased frequency of dosing to control their pain. If a patient is using the medication for maintenance therapy in opioid abuse, they would typically titrate a dose for the patient that would make them not have any withdrawal symptoms for 24 hours. This would typically be 80 to 120 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using methadone, so I'll go over some of those here now. Some patients may experience hypotension or low blood pressure, while others may experience diaphoresis or profuse sweating. Constipation, nausea, and vomiting are possibilities with methadone. Some patients may experience anathenia or abnormal weakness, as well as dizziness. And lastly, some patients may experience lightheadedness or sedation. Now, some more serious side effects with methadone would be adrenal insufficiency that we discussed in the precautions section, hypoglycemia or low blood sugar, anaphylaxis, respiratory depression, or serotonin syndrome. That's all we're going to talk about today with methadone or Methadose. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.